8 tips that you should know before and during your residency training. Hi, welcome to this video. My name is Dr. Farzana Haq. I'm an assistant professor of medicine. I'm also working as a co-director of acting internship. Over the many years, I have learned some parts that I hope I would know during my residency. I hope you would be in a better position during your residency training compared to me. So that's why in this video, I will share with you my favorite top 8 parts that I have learned that will help you to become an confident and efficient resident. First and foremost, do not expect that you will know everything. Admit it, you are in training. You may have completed all of your USMLE steps. You may have wonderful scores. However, you are still learning. You are still in the training, so nobody expects you to know everything. So do not put the pressure on yourself that you have to know everything. That comes to my second point. If you find out that you are not certain about any management, about any decision, feel free to ask for help and advice from your senior, even from your co-intern or resident, because as human being or as physician, we do not have answer for every questions. And it always shows that you are eager to learn when you are asking for advice or suggestions. So reach out to your senior resident or your attending if you are not certain about any situation or do not know the answer. Because remember, patient safety comes first. We are every day doing a lot of hard work because we want to care for the patient. Number 3 is that know your team. I cannot stress that how important it is to know your team. Know their name, know them as a person. You do not have to know every detail of their personal life because our goal is to be professional. However, when you are acknowledging them with their name, with their right pronunciation of name, with a smile, remember your team member will value it. Medicine is not a solo game. This is a team effort. I always tell my nurses, my students, that I cannot do everything to take care of the patient. I need nurses, case manager, social worker, respiratory therapy, transport, cleaner, everyone. So respect and know your team. Number 5 is that always acknowledge other people's success. Do not get jealous because as human being, it can be sometimes intimidating by our colleagues' success. But remember that you should see a positive way. See in this way that if your colleague can do it, you can learn from her and you can do that as well. It should be your inspiration, not be threatening for your success or for your profession. So acknowledge other pupils, other residents, your co-interns, co-residents' success. And believe me, they will do the same because people want to give back to you if they get good things from you. It is very true for the bad words or bad thing as well. So acknowledge and get inspired by your colleagues' success. And then one of the important points is self-care. If you are not full, if you are not taking care of yourself, you cannot take care of other people. So take care of yourself first. I understand it's not possible for you to prepare a healthy breakfast at the morning, because when I used to leave my home when I was intern, sometimes at 5 or 5:30, it's not possible to do everything in the morning. So what you can do, try to do some preparation the night before, maybe prepare your lunch or try to have some healthy snacks for your shift, particularly during your on-call day. Have a banana, have some nuts, maybe have a carrot. Those healthy snacks will give you energy and will help you to stay attentive and fit during those long shifts. And then it lead to a next important part is that wear comfortable shoes. I know it may sound very simple, but if you are not attentive, if you are wearing a hard shoe in your on-call day, you will remember it, these tips, after coming back to home. So I do not want you to suffer. Make sure to wear comfortable shoes during your inpatient rotation and particularly during your on-call days. Then it comes to an important point that if you are intern, you do not have to run the code. However, assist your senior resident to run the code. Follow his or her instruction. Maybe she wants you to review the order, or maybe she wants you to put the order during the code or review the chart, or maybe call the family member. So it is always ideal that before the code, before the rapid response, have an open line of communication with your senior resident, that what is the expectation from you as an intern. And after you were resident, senior resident, over the years, the experience, the more you will do code rapid response, you will gain that confidence. And the final tips I would like to share with you, that observe. What do I mean by observe? Observe that how your attending physician is handling a code status discussion, how your attending physician is talking with the angry patient, or maybe how your attending is giving a negative feedback to a student or to a resident. Because the more you will observe, you will have better understanding that how a thing can be done in a wonderful way, or maybe sometimes you will pick up that, okay, I do not want to do in this way. Maybe I have a better solution. Observing our surroundings sometimes open us a wisdom, open us a open world, maybe sometimes we never think about. So have that open mindset to observe your senior physicians, your senior residents, so that you can pick up their good parts and then you can implement to your practice. I hope you will find these 8 parts valuable as an intern or resident. If you have any other advice or belief that you are doing that is helping you, please put it in the comment section so that others can be benefited from your wisdom. If you have any questions or if you want me to make video on any particular topics, please let me know. I would love to hear from you. If you are new to this channel, please like this video, subscribe to this channel. I will be with you with more content in near future. Until then, take care and be kind yourself. Bye-bye.